Hi everyone, this time I'd like to talk about CT findings of the nutcracker and compare them with Doppler ultrasound findings. And this is an example of Doppler ultrasound of the nutcracker in a 36-year-old man with proteinuria, flank pain, and fluctuating glomerular filtration rate. The ultrasound well shows dilated hilar left renal vein with a tight compression of the aortomesenteric left renal vein, and also color Doppler shows a sluggish flow in the dilated left renal vein. And peak flow velocity was 182 centimeters per second at spectral Doppler. In 2011, we published an article in European Journal of Radiology reporting the findings of nutcracker phenomenon in CT. In this article, we reported the characteristic appearance of dilated left renal vein and abrupt triangular narrowing between the abdominal aorta and superior mesenteric artery, and called this sign a big sign, which was highly sensitive and specific for nutcracker diagnosis. Nowadays, CT is commonly used as the initial imaging study in patients with hematuria. In the early phase images of contrast-enhanced CT, we may see the flow of contrast-opacified blood in the left renal vein moving into the inferior vena cava. Here are two different patients, one without nutcracker phenomenon and the other with nutcracker phenomenon. On the left side, contrast-opacified blood flows in a plug flow pattern, moving at the same speed. But on the right side, we see the jetting phenomenon of contrast-opacified blood through the narrow aortomesenteric left renal vein. Here is a young woman with proteinuria. The grayscale ultrasound well shows dilated hilar left renal vein and tightly compressed aortomesenteric left renal vein. Color Doppler shows bright colored high velocity jetting through the narrowed aortomesenteric left renal vein. Peak flow velocity at spectral Doppler was 140 centimeters per second, approximately 3 times the normal velocity of 40 to 50 centimeters per second. A CT scan in this patient also shows jetting of contrast-opacified blood through the narrowed aortomesenteric left renal vein. This is a young man with microscopic hematuria, proteinuria, and left flank pain. Ultrasound shows findings of nutcracker with a bright colored jetting flow at color Doppler with peak flow velocity of 141 centimeters per second. CT scan shows subtle but similar jetting of contrast-opacified blood. This is an old woman with microscopic hematuria. Ultrasound shows compression of the left renal vein by the origin of the right renal artery with intermittent bright colored jetting phenomenon anterior to the compression site, and the peak flow velocity was 101 centimeters per second. CT scan well shows compression of the left renal vein by the origin of the right renal artery, which arises somewhat anterior direction, and the flow of contrast-opacified left renal vein blood along the non-dependent anterior margin of the inferior vena cava, indicating relatively fast flow, like this schema. This is an article we published recently, and we found that there are 4 patterns of contrast-opacified left renal vein flow. First, a plug flow that is normal, and the last, a jetting pattern that is abnormal, indicating a nutcracker phenomenon. 2 more patterns are preferential flow of heavier contrast-opacified blood. One is along the dependent posterior margin of the left renal vein and inferior vena cava, indicating slow flow, and the other is along the non-dependent anterior margin, indicating faster flow. This case on the left is a pattern 3 flow along the non-dependent anterior margin, and this case on the right side is pattern 4, jetting flow. These patterns 1 and 2 indicate slow flow and absent nutcracker phenomenon, while pattern 3 and 4 indicate faster flow and this suggests nutcracker phenomenon. These are examples of non-compressed left renal vein with normal plug flow, pattern 1. Slightly narrow aortomesenteric space but contrast-specified flow along the dependent posterior margin, pattern 2 flow, suggesting slow flow and absent nutcracker phenomenon. A young man with gross hematuria. Cystoscopy shows gross hematuria from the left urethral orifice, and the CT shows a flow of contrast-specified blood along the anterior non-dependent margin, pattern 3 flow, indicating fast flow and so nutcracker syndrome. Another case, a 17-year-old woman with proteinuria. CT imaging in the early arterial phase shows findings of jetting, pattern 4, or flow of contrast-specified blood along the non-dependent anterior margin, pattern 3. Color Doppler ultrasound also shows bright colored fast flow along the anterior margin, and peak flow velocity was 150 centimeters per second. This is a 50-year-old woman with intermittent gross hematuria. CT shows jetting of contrast-specified blood through the narrow aortomesenteric left renal vein into the inferior venous cava, pattern 4 flow. Color Doppler ultrasound also shows intermittent jetting of bright-colored fast flow from the narrow aortomesenteric left renal vein and sluggish flow in the dilated left renal vein. In another lecture on the nutcracker in this Congress, I mentioned that there are 3 types of the nutcracker. Type 1, left renal vein compressed in the narrow space between the abdominal aorta and superior mesenteric artery. Type 2, left renal vein compressed posteriorly by the origin of the right renal artery. And type 3, left renal vein narrowed and stretched over the abdominal aorta. So there are 3 subtypes of the nutcracker and 4 flow patterns of left renal vein flow in CT. This is a 48-year-old woman with left flank pain. The ultrasound shows type 2 nutcracker, left renal vein compressed by the right renal artery with peak flow velocity 165. CT scan also shows left renal vein compressed by the right renal artery and pattern 3, left renal vein flow along the anterior margin. So considering all these findings at ultrasound and CT and the patient's symptom of left flank pain, we can make a diagnosis of nutcracker syndrome. This is a 40-year-old woman with periumbilical and right flank pain for several years. She underwent CT scans 3 times without detecting any cause of her symptoms, and she visited my clinic with those CT images. When I reviewed her CT images, instantly I found pattern 3 or pattern 4 findings of left renal vein flow and decided to do Doppler ultrasound examination. Grayscale and color Doppler show type 1 nutcracker and sluggish flow in the dilated left renal vein with a peak flow velocity 128 centimeters per second. I continued Doppler exam with changing patient's posture, supine, left lateral decubitus, and right lateral decubitus. The first row images are in supine posture with peak flow velocity 128. When the patient took left lateral decubitus posture, as in this second row, superior mesenteric artery moves to the left side, and left renal vein compression is much relieved, and the peak flow velocity was decreased to 56. And when the patient took right lateral decubitus posture, as in the third row, superior mesenteric artery moved back to the pre-aortic location, and again, left renal vein is tightly compressed with a peak flow velocity 136. She was recommended to take left lateral decubitus sleeping posture, and her symptoms of periumbilical and right flank pain was improved. This is a nice example showing if we notice the CT findings of the nutcracker earlier, the patient might have been diagnosed and managed earlier. Gross hematuria occurred in a 58-year-old woman following dental scaling. CT scan was done to detect the cause of hematuria, but she heard nothing about the cause of hematuria. She brought her CT images, and there were only nephrographic phase images. Although we do not see densely opacified left renal vein flow, we may notice subtle narrowing of the aorto-mesenteric left renal vein and the flow of slightly higher attenuated left renal vein along the anterior margin of the inferior vena cava. Ultrasound was done, and it well shows type 1 nutcracker with sluggish flow in the dilated left renal vein and high velocity jetting with a peak flow velocity 141 centimeter per second. CT scan is superior to ultrasound in detecting variations of the left renal vein and associated nutcracker phenomenon. This is an example of retroaortic left renal vein, and if nutcracker phenomenon is associated with this variation, it is called posterior nutcracker. This is a 49-year-old woman with microscopic hematuria and proteinuria. CT scan shows retroaortic left renal vein compressed between the aorta and vertebral body and jetting of contrast opacified flow. Ultrasound also shows similar findings with peak flow velocity 94.8 centimeter per second. This is an example of left-sided inferior vena cava in an 18-year-old man with gross hematuria. Because large amount of blood from the lower extremity occupies the left renal vein, and therefore flow from the left kidney should pass functionally narrow space, and nutcracker phenomenon may occur. Here you see left side inferior vena cava, which is not opacified yet, and the contrast opacified blood from the left kidney flows functionally narrow space, and the peak flow velocity was high, 182 centimeter per second. This is a 61-year-old woman with microscopic hematuria and proteinuria. Ultrasound shows left renal vein compressed by the right renal artery with peak flow velocity 162 centimeter per second. CT also shows left renal vein compressed by the right renal artery and contrast opacified flow along the anterior margin. So type 2 nutcracker and pattern 3 CT flow. Another example of type 2 nutcracker and pattern 3 CT flow. Compression by the origin of the right renal artery with peak flow velocity 199. And CT shows type 2 nutcracker and pattern 3 flow along the anterior margin. Another similar example, type 2 nutcracker and pattern 3 flow in a woman with microscopic hematuria with peak flow velocity 114. CT also shows left renal vein compressed by the right renal artery and opacified flow along the anterior margin. This is an example of type 1 nutcracker with pattern 4 flow in a woman with gross hematuria. Ultrasound shows type 1 nutcracker with bright colored jetting flow from the narrow aorto-mesenteric left renal vein with peak flow velocity 131 centimeter per second. CT shows pattern 4 flow with jetting into the inferior vena cava. And this is an old man with abnormal glomerular filtration rate, and ultrasound shows type 3 nutcracker, left renal vein stretched over the aorta, and CT scan also shows findings of type 3 nutcracker and jetting of contrast opacified flow, pattern 4 flow. This is a young woman with gross hematuria for 2 weeks. She visited 3 hospitals and did CT scan in every hospital, but did not hear about the cause of hematuria. These are those CT scans. I reviewed the CT scans carefully with special attention to the left renal vein. Here is the first CT scan. Left renal vein looks normal with a plaque flow pattern, pattern 1. In the second CT scan, left renal vein looks compressed between the aorta and superior mesenteric artery, and the left renal vein flow looks like pattern 3 along the anterior margin. In the third CT scan, aorto-mesenteric left renal vein is tightly compressed, and we see jetting of contrast opacified blood, flow pattern 4. Important thing we should keep in mind is that CT findings regarding nutcracker phenomenon are very different among CT scans, and this difference is probably related to the different status of respiration during CT scan. Generally, nutcracker phenomenon is more severe in expiration state than in inspiration state. Ultrasound was done in this patient. Grayscale and color Doppler show findings of type 1 nutcracker with sluggish left renal vein flow and the peak flow velocity 153 centimeter per second. Here is a 60-year-old man with gout. CT scan shows findings that may suggest type 3 or type 1 nutcracker, and ultrasound also shows similar findings with prominent bright colored jetting flow with a very high peak flow velocity, 236 centimeter per second. CT scan is not an early phase imaging, and so it is difficult to assess flow pattern, but considering these color Doppler findings and the very high peak flow velocity, we may see pattern 4 flow if we have early phase images. We know that it is not easy to pay enough attention to see left renal vein carefully in every CT images of the abdomen. So now we are doing a study to test feasibility of artificial intelligence in recognizing and categorizing the left renal vein flow pattern to help our practice of CT reading. This is the summary slide. In most of the abdominal CT images, we may recognize the patterns of contrast opacified left renal vein flow, and we may suspect nutcracker phenomenon if we see these high velocity flow patterns, pattern 3 and pattern 4, and we may accurately measure flow velocity with Doppler ultrasound. Thank you for joining this talk, and if you have any questions or comments, please email me.